My name is Dr. Kevin Campbell. I'm a cardiologist from Raleigh, North Carolina. I've been practicing medicine for over 17 years. I'm married to my lovely wife, Deborah, for almost 19 years, and we have one child together, our son, Beck. In all honesty, I'm burnt out with modern medicine and the way healthcare is being delivered in the United States today. Government interference in my exam room, telling me what I can and cannot do, making me charge people who can't afford to come to my office because of government regulations, when normally I would just write that off and see those people. Medicine has become an algorithm rather than a human-to-human interaction. As a result, about a year ago, I closed my practice as I felt that I couldn't be part of traditional medicine the way it's practiced in the US. And since that time, I've been looking for my next adventure. Recently, I was offered the opportunity to lead a medical team in a remote island called Batiki off the coast of Fiji, halfway around the world from Raleigh, North Carolina. It's amazing how hard it is just to even find Batiki. They've got a Wikipedia page, but it's not very big. It says that the head and shoulders are sacred and that it's disrespectful to the village elders if you wear anything on your head or shoulders. That's a problem because I'm losing my hair. Well, the plan is, so I'm told, is that we're going to set up a medical clinic and start treating every native on that island. Everything from hypertension and diabetes to typhoid to whatever imaginable disease that we run into on that remote island. So we'll start with medical supplies. We have to bring most everything we need. So I'm absolutely terrified about this trip. I am not a camper. I don't like roughing it very much. My survival friend told me this was critical to have. I've not had to live without much. You know, my idea of going away is a first-class airplane ride to Europe and staying in a Ritz-Carlton. And, you know, I'm going to a place with almost nothing. Need some shorts. These are actually mosquito-repellent pants. If we're walking through the jungle, who knows what we're gonna get into. Honestly, as a cardiologist and a surgeon, I'm a control freak, and I get very upset or I'll get frustrated or angry about small things. This is a bit overwhelming. I have to get everything I need for 3 weeks on a remote island in 2 bags. And now, everything from my transportation to how I live, to where I sleep, to where I go to the bathroom, is completely out of my control. And I think that is gonna be a huge challenge for me. I guess I don't need my Gucci's for Fiji. Oh, I love these shoes.
I'm worried that he's not going to be able to integrate himself well enough into the whole idea of not having internet access, not having shower access, not having necessarily the nicest bathrooms.
You ready for school? My son Beck, who was designated female at birth, is in the process of a gender transition. In addition, Beck has type 1 diabetes, and we have lived with diabetes in my family since Beck was age 5. I have the financial wherewithal to pay for the best insulin pumps, the best drugs, the best care that money can buy. And my child has thrived with diabetes. For me, I feel like it's my responsibility to help others who don't have those same advantages. So this trip, it's personal for me. You know, Beck's overcome more than I could have ever overcome. And I know if I had been dealt a hand of type 1 diabetes at Beck's age, I don't think that I would have been as strong or had the same ability to overcome this. And Beck inspires me every day to do good, and that's why I'm going to Batiki. I'm not sure I'm strong enough, physically, emotionally, mentally, but I think this is a time in my life that I'm looking to do something rather than just say something. Because, you know, I can talk to you all day about how I don't think what we're doing in the United States in healthcare is good for patients or physicians, but it's time to put up or shut up. I'm flying from Raleigh to LA, LA to Australia, and from there it's a mashup of trains, planes, boats, and automobiles to get to the mainland of Fiji. Along the way, I'm picking up my dear friend, Dr. Suzy Feigofsky, who is joining my team and will be my right-hand woman.
I'm here to be Kevin's bitch. I am here to support Kevin on the medical team, to help keep him calm, I think. and to just do whatever he needs me for. I mean, I'm game for anything. The reason I'm here is, I think, selfish in a way. I am gonna be 45. I think I'm having a midlife crisis. I feel internally just restless and a bit unfulfilled. It's hard for me to think about, leaving my children for a long time. I just want to know I'm a good person and that I'm doing something and leading by example for my kids.
Ready to go. With our entire team together, we headed out on the last leg of our trip. My goal when I get to the island is do a health assessment on every single person there. The other side of the medical thing is, people are gonna come with acute illnesses. They're gonna have a cold, or they're gonna have a respiratory infection, or they may come and a cut to their foot or a cut to their finger or something of that sort. They may have a broken bone. We're gonna treat those as well. And it's gonna be like kind of a MASH Army field hospital, but that's what we're gonna do. We finally made it to Batiki, and the entire village came out to welcome us.
Arriving was really lovely. They were singing to us as we were coming into shore, and that was really awesome.
The villagers gave us a glimpse of where we'd be staying for the next several weeks.
It's a bit unsettling to look up and see like maybe 100 wasps all huddled together, waiting to sting me to death.
The shower's not really a shower. Shower's actually a place where you can dump a bucket of cold water over your head. After checking out our digs, we headed towards the village center where we got a very special welcome. It's something the locals on the island call a kava ceremony. Kava is a cocktail made here in Batiki to celebrate when two tribes or groups officially come together. The ceremony also includes making new friends and just a little bit of dancing. It was a great way to meet some of the locals and get a feel for how the next few weeks will be. I'm really excited to get started tomorrow. I'm overwhelmed. Didn't sleep really well. There was a lot of noise, chickens and kids running about, and I'm just a little anxious. Just having a moment over here to gather myself is important because I can't let any of this doubt and weakness show because they're looking to me for leadership. Plan is to head over to the medical clinic, get things set up, and do what I was meant to do here. On my team, I have Anne, who is a family physician who will work with any kids who come.
Our job is to kind of take all of our medical knowledge and make their culture just a little bit happier and healthier.
Kate, a nutritionist from Australia. So these are the diabetes testing kits.
I think so.
And we also have Tala, whose big job it is to run the one and only medical clinic on Batiki.
Since I'm the only one here looking after the whole island of Batiki, it's a challenge. I'm looking forward to working with the doctors and the nurses, and I hope to learn a lot from them.
Well, we got our first patient.
Yes, three.
Can you take a big deep breath for me? In and out, great. Another big breath, in and out. So I was treating our first patient, and by the time I turned around, we had about 50 more. We were worried nobody would show up, but wow, we have plenty of patients now. We're gonna be busy today.
Like straight.
Want to hear your heart? I know it takes a lot of time to let them listen to their heart, but I just love the look on their faces.
This may be the only opportunity they ever get. I think it's fantastic. Yes. Everything happened all at once. Everybody started showing up. In fact, half my team was over in the other village gathering supplies. We have just been overwhelmed. We've already run out of forms. Somehow we didn't have enough forms, so now our medical intake form looks like this. I'm a little nervous about making sure that we're able to keep track of everybody.
And I would say we just have an adult station and a kid station, and we just make the best of it.
Exactly. Where's Ann? Okay. The entire school came, and we're trying to process everybody efficiently, maintain good data, and as you can hear, it's terribly noisy. It's hard to listen to hearts and lungs. I think Our staff is a little bit frustrated and a little stressed, and I'm trying to kind of try to organize this chaos. We have adults who want to come in, and we're overwhelmed with children. So I think I'm going to make a kids room, an adults room, and an eye test room. So what we may do is just set up a kids and adult station and have you relieve Suzy over there, because I think it's becoming chaotic, and I don't think we're accomplishing what we want to accomplish because we have so many people. If you guys, I think Suzy probably needs a break. If you guys want to go there, and then we can check vision over here.
No, she's looking for another one. No, this is
Is that cool?
I'm gonna try with this one.
Wow, it was a little bit tough leading at first with new people. I don't think Ann totally wants to listen to me right now. Well, that way we got
We'll
one Pete's cuff, and then just
Okay,
if
we'll
you guys
give
want to
her a break.
relieve her,
Yes,
and then if you want to keep doing vision, perfect. Okay,
let's go.
and then we'll see the adults in the middle room. Okay. I think Ann may be used to being in charge and not really used to taking orders. Why don't you guys relieve her over there? And then I had to repeat myself so many times, but I think I ultimately got through to her. It's day one, so I'm just going to tread lightly, and hopefully we can all work well together. So I think what I've got going on now is I've got her busy, which is a good thing, seeing kids. And then we're going to do eyes in there and adults in here.
Okay. And I think feels a little left out because Kevin and I do know each other. And so I'm trying to figure out how to make her feel more included.
I think Anne is just bothered by the noise, which I'm fine with.
Right,
because I'm
we
used
have
to
to
it.
adapt. This is not a clinic in the States. Once we got our game plan in motion, everything started going smoothly. We spent most of the day seeing kids, moms, dads, really anyone who showed up.
They all hurt?
Our last patient of the day came in and kind of gave us a bit of a surprise.
Does it go away?
No.
Do you get any on your face?
No.
Has anyone else in your family had this?
No.
This patient, who has been living in this village for years, come to find out, has an extraordinarily rare condition called neurofibromatosis. I don't have any cell service right now, and wants to do, I'll look it up back at the house and maybe have him come back tomorrow. This was something I'd never seen outside of my residency. This is a condition where tumors grow on the skin surface, and the only way to really treat it is through surgery, which we can't do on the island.
So how long have they been there?
High school, eh?
High school?
We immediately sent this patient on the first boat off the island so he could get some really urgent and much needed relief. I'm really glad he came to see us, and hopefully we can get him some help. How are you doing? Today I'm doing house calls near our village. 120 over 80. While Suzy treks off on her own adventure.
Today we left our village and we went to Naingani, which is on the other side of the island. Naingani is the village that was completely wiped out by Cyclone Winston last year.
Big wave come from the sea, really high tide.
We got to meet with Jim, who's the pastor of the village, who told us the story of the day of the cyclone, which was really hard to hear.
As we were trying to get into shelter, the wave started striking the whole village. As soon as we got into the concrete building, the biggest tidal wave has come in. I heard my wife crying out. The kids are drowning in the room. It just broke the door open and swept us in the house.
I mean, here, it's life and death in an instant. Like, his whole village was wiped out with 3 waves. I mean, think about that. Like, 3 waves destroyed everything.
It really hurts a lot to see everything is gone. The houses and what we own is gone.
I had never even heard about that cyclone, honestly. Didn't even know it happened. It's just, I can't even process it right now. It's just really tough. Really tough. And just as a mom, with him thinking his daughter was drowning, just terrible. It's just really terrible. Sorry. Sorry.
One of the Batiki elders told me that they have a villager who identifies as transgender. He was born a man named Peter, but identifies as a woman. Having my own son who is transgender, it meant a lot to me that I could go and meet with this person. What do you prefer to be called if you were given the choice?
I like Beatrice.
Beatrice,
They call me Beatrice.
You identify as a transgender person. My child, my 16-year-old is a transgender. Beck was born a girl and identifies as a man and is dressing and behaving as a man.
So I love cooking and go out with the girls, join the girls in doing this.
That's where you feel comfortable?
Yes.
Yeah.
I feel comfortable with that.
My child faces discrimination and faces people aren't nice to Beck all the time. How have your neighbors and the villagers responded? Are they supportive?
No, they already, yes.
So they just
know that I'm like his.
We could learn a great deal from you and the way your village accepts you with open arms. Because we're just people, right?
We're just people, yeah.
You know, no matter where you are in the world, people are people. Tanaka. Tanaka. We spent yesterday doing home visits and now we're back at the clinic for day 3. So far, we've learned that the people of Batiki like to drink a lot of kava.
After work, how many do you have?
All night until morning, then go back to work.
Really?
Yeah.
They also don't really have any sort of regular fitness regimen. Do you exercise at all? I know you work hard. They drink so much kava that I did a little research and found out that kava can actually result in severe liver damage.
How much kava do you have in it?
Maybe
50?
50.
Another issue that we found is that many people with serious ailments will not travel to the mainland for help, which is why we're seeing a man who's had an issue with his eye for years. Yeah, so I think you're blind in your right eye.
Do I need glasses now?
Well, I think we need to get you to the ophthalmologist. What I see on exam makes me concerned that there's something going on with the nerve to the eye. We also saw a woman who tore her knee ligament over 6 months ago. Is that hurting? Sorry. Oh my gosh. There's multiple ligaments, and they crisscross and they make the knee joint stable. We're gonna put this on because it'll help you walk, but I think you probably need to go to Suva and get an x-ray, and you may actually even need surgery on the knee. Do you remember when you had the injury, did it immediately hurt? Did you hear any popping noise?
Just like this.
You tore a ligament. Sometimes these will get better on their own, but I think this is surgical. I really do. We've only been on this island for a few days, and what was most shocking was that we'd already seen dozens and dozens of cases of hypertension, along with every other ailment you can possibly think of. It's no doubt that the people of Batiki need our help. I just wonder if we have the time, the manpower, and the tools to treat them all. When we visit somewhere like Batiki, we don't just come as doctors. We have to act as nutritionists, therapists, contractors, even farmers. Teaching the people here to be healthy doesn't mean we're just in clinic measuring EKGs, checking blood pressures, and stitching up cuts. We have to show them that being healthy spans all aspects of their life, including their diet. One of the biggest things that we've learned so far is that the villagers on Batiki have a high rate of diabetes due to a diet that's high in starch. They eat very little protein and fresh vegetables.
Chickens have had a free reign in the Pacific for too long. So everybody complains about them. You put seedlings in and they scratch up the ground and dig out the seedlings, and then they can't catch them, and the eggs are everywhere, and they can't get the eggs, and they like the eggs, so let's put them to work.
Exactly. Today, we're building chicken tractors. These are enclosed pens that help the natives house chickens so that they can have access to fresh protein via eggs and meat. It also has a dual purpose. Each day they can move the tractor to a new plot of land and it will fertilize the ground beneath it, allowing vegetables to grow.
We'll build one, and then the guys will see what we build, and like the Delo dryers, we built one, they built the other, they just copied.
Well, that's the whole point of this, right? We don't do it for them, we do it with them. This has been the hardest thing I've ever done in my life. This has been incredibly challenging. I came here knowing it was going to be hard, but nothing prepares you for how difficult this experience is for a Westerner. This is a beautiful culture. It was an absolute privilege just to even have the chance to be here and to get to know them and to become part of their village.
I have very mixed feelings about Batiki. Very sad to leave. I feel like I really became a part of that village.
Being on Batiki has helped me learn to embrace the small things, appreciate the moment, live in the moment, and not always think about what's coming next. Was Batiki a struggle? Yes. Was it hard? Of course. Would I do all of this over again? In a heartbeat.